Today, we've got a topic that is something that is fairly near and dear to my heart and a lot of my family and associates that I think have had a lot of experience that comes into play here. And it's something that we here at Kleidon Associates have worked with quite a bit. And that really focuses on the topic of stigma, particularly as it relates to mental health and mental health disorders. I'm excited to get into it. But I'm going to go ahead and introduce Jessica Yeager. So, Jessica, first of all, welcome to the show.
Thank you. Thanks for having me.
Welcome back to another episode of 3 for 3. I'm your host, Kurt Kleidon. And so we have a guest on the show that really is going to give a lot of specific topics and tips and ways that we can think about how we can make a difference, how we can educate, how we can bring things to certain lights so that we as an overall community and as humans can have better understanding about things that we don't understand, because that really is the basis around where stigma starts, just not understanding what that looks like. So I'll give you a little bit of background around where Jessica comes from. So Jessica Yeager is the operations manager for communications at OhioGuidstone. Jessica brings over a decade of experience in nonprofit marketing, particularly focused on behavioral health care. Since 2020, she's been leading communication strategies at OhioGuidstone to promote their wide range of services, breaking down barriers to ensure individuals and families can access the care they need. With a bachelor's degree in business and organization communications from the University of Akron, and as a qualified mental health specialist in Ohio, she's deeply committed to raising awareness and driving initiatives that boost referrals and visibility for the organization. Before joining OhioGuidstone, Jessica played a pivotal role in developing Medicaid coverage policies for adopted children and those in state custody, and she even helped pass a human services levy in Ohio. Outside of her professional life, she's an ultra runner, having completed 200-mile races, and enjoys adventuring with her significant other and their dog, Motley, in Brecksville. So, Jessica, I have to start off by asking, how did you get into ultra running, and how do you prepare for something like that?
So it's all actually very related to mental health, right? So my outlet for mental health is running. I very much am an outdoors person. And I had a bucket list item of I want to do a marathon in my lifetime. And so that escalated very quickly. I did my first marathon and I just kept training and running and completed my first 100-mile race, and a huge learning experience as well. And we will talk about some of these things with mental health, but you're out there training for many, many hours, and you really get inside of your head, and it's a great opportunity to just really understand yourself. So I've really enjoyed that quite a bit. It's probably one of the top 5 moments of my life of completing my first 100-mile race. So
I can imagine. I can imagine. And just the mental preparation that would go into something along those lines. I mean, that's a lot of time to be thinking and processing things, not only about how your body keeps going, but I'm sure a lot around it as well. I'm a runner, and I've done a fifth of 100 miles, or I should not a fifth. 5 miles of that here recently in the Akron Marathon relay. But just even having that chance to get outside and kind of just within your own space and your own bubble, I just really have the chance to reflect upon a lot of things. So I'm really curious to hear how you tie that into your profession and your work. And why don't you just give our listeners a little bit of sense of the why? Why did you get into this profession? What were some of the doors that opened, or the reasoning behind them?
yeah, so I joined OhioGuidstone during COVID, actually. So I think that it's just so great when we had a peak need for mental health and mental health crisis in the country at that time. So we're, still seeing the effects and impact of that and people reaching out in need of services. So I actually started at OhioGuidstone working with clients to help make sure that they had a payer source so that they could continue to receive their services. A lot of times with marginalized or underserved communities, they don't have the resources to be able to even navigate the systems that we put in place to have their benefits and coverage in place. So my role really started to work with individuals and make sure that they could continue their healthcare coverage. So I really had a forward-facing role working with clients and then in between the agency as well. And my background, of course, is in marketing and communications. So I moved into that role and now really help manage many of our projects and just different things that we do at OhioGuidstone. We serve so many people. We serve over 26,000 clients across the state of Ohio in a year, and we provide just a full continuum of behavioral health care services. So, and behavioral health is also just a combination. It's mental health and it's substance use services. So there's oftentimes a need for those that have a dual diagnosis. So we're able to help and work with people to really treat their entire needs and help them have an improved outcome, which is great.
Yeah, it's wonderful work, and I just appreciate what you do and what your fellow folks at Ohio Guidestone do for just our general community. Uh, Tell us, when you hear the word stigma, what does that mean to you? How do you, when is it a dirty word to you? Is it something that you see as an opportunity? How does that impact how you go about your life and your work?
Sure. I mean, as a communications professional, it's something that I obviously want to tackle and knock down as a barrier. I think when I remove myself from that, I really think of a stigma as something that people want to stay away from, right? So, in our role and being able to communicate and help break down those barriers, for me, it's 100%. Obviously, working for a nonprofit, we really want to be able to maximize our efforts and have the greatest impact across all of the communities that we serve. So for me, that's what I think of. It's a challenge, but I think it's one that I am, always eager to face. And I think we are able, as technology progresses as well, to really reach more people and help break down those barriers and help break those stigmas for not just mental health, but all kinds of other stigmas that exist as well. So.
Yeah. Well, and as you mentioned there, the evolution and just the changing atmosphere of both technology and communication tools, even as we speak, it's really affecting how people get their information. And so the people that are listening to this episode, I'm sure there's going to be a lot that are saying, I want to hear maybe some new tips or how things are how things are developing in a way that can help them do their job better, or ways that they can improve whatever stigmas are within their profession to make some difference within their field. What are you seeing, or are there any kind of examples of stuff that you're doing that's really starting to have an impact and help break down those barriers?
Absolutely. I think for us, our focus has really been on three key areas. One that I am very, very passionate about is our ability to be able to do storytelling. And so some of these things are really back to the basics, but it's how can we use these new tools and technology to enhance them and really expand that reach. So, for example, our storytelling, we can use a client's story, which is amazing and very transparent, and being able to really help share their experience from their perspective and their words to the general public. So, if we're trying to reach other healthcare professionals or other people in need of these services, that individual is really able to speak to their own story and share their testament of what has worked for them. And it's great because it's genuine. There are ways to make that digestible for people and really understand it. But I think that there's this empathy piece that gets brought into that's where we can help reduce the stigma. So many times people that we are working with maybe don't want services, right? I mean, it's nobody's like ready, like, yay, particularly I'm thinking about a recent success story that we shared of a client that had a substance use disorder. And so that's a very long path for that person. Their story is a lengthy one, and it's not always on the first encounter with that person that they do have success in their recovery. And so for that person to be able to share those things, it really helps empower those that are, considering or contemplating what their status might be, to seek out help or treatment or whatever they may be in need of. So I think that that's something that we have really taken to, and I just selfishly really enjoy hearing their stories as well. But we're able to share that in so many different ways. So I think that being able to have things like that where someone comes forward to their clinician and they want to talk about what they have experienced, uh, it's great because it's real, and it's great for them to be able to feel empowered and, like I said, reach those other communities, for people that may be struggling as well and really understanding. I mean, as providers, we have providers that are peer recovery specialists, so they have lived experience, which is fantastic. But also, the more and more people can hear about someone that has been through exactly what they've been through, I think people are more likely to want to be able to receive help and understand it better too.
Absolutely. Yeah, I'm a big proponent of storytelling. It just allows people to first off, we need to be able to keep people's attention, which can be a challenge right now. But the ability to hook someone in to just be able to, like, I want to hear how this story ends. It's just a natural way of being able to continue to say this is this slice of life, and make some examples out of that. What are you finding, Jessica, as far as the types of storytelling? So stories can be told within the written story, with video, with audio only, like here on podcasts. Are you seeing any kind of trends or anything that's helping that be more effective?
I think a little bit of everything. So what we'll do is, we can do a full 4-minute video about this person's story, and that's not going to work for everyone, but being able to make a 15-second digestible reel to post, for somebody to catch a glimpse of is also helpful. So we'll use just pieces of the longer format video to be able to share that, and we can put that on our website. We can put things in newsletters to community partners and just share those pieces that are applicable to whoever you're trying to reach. So that person can be talking about the services, which is going to be a greater for our community partners that help us with referrals and, meeting the needs of someone that they might not be able to support and help, but we can, versus maybe looking at other um, people that are within the profession to be able to talk about it as well, and maybe share their own story, and then also that client base. So we're always trying to reach with everything that we do many different audiences. So being able to use one thing, and as a nonprofit trying to maximize all of those things is really important. So social media is really a key tool to be able to share that message from what we've created. And then we're also able to take those things and pitch a news story on that, or have a reporter pick that up. That actually is recently happening with this particular story as well. And so the client is really able to take the lead on that and share their perspective even further. So it can go into just a small print. We're also able to, and something we have been working on at OhioGuidstone is, we have publications and we share these success stories in our publications, which is wonderful. And we're transferring to make those things digital and more interactive for our readers. So we're able to plug in not only the written content, but then share that video content right along with that. So it's very dynamic for the reader to be able to get involved with it as well, which is great.
Mm-hmm. Yeah, so it really all starts with the story that's created, and some people call that cornerstone content, and you rely on that, and then you slice and dice it in a lot of different directions, a lot of ways to go. And I think that's that. If for anyone listening to this, that's saying, "How do I get started?" And it's a great way to think about it. Start with your story, and then don't just put it like one social media channel. Look at your different opportunities, and as Jessica just said, the different audiences that you're trying to tap into. Jessica, you started to talk a little bit about how that plays a part into social media. What kind of platforms are you using, or where do you see the most impact that some of these stories can have within the various platforms that exist?
Sure. Most of our audiences are on the Meta platforms, and we find most of those people actually on Facebook is where our larger demographic is. We also use X and LinkedIn, but we're able to share those reels on Instagram and Facebook as well. So we're really able to connect with people mostly through the Meta platform.
Mhm. Do you set it up in a way that it is that you give a little snippet and then you direct people over to, let's say, your website or YouTube channel to get the full story? Do you have any strategies along those lines that would be helpful?
Sure. So obviously also trying to maximize traffic to our website as well and increase our reach and where we're ranking on Google as well, and making sure that people are finding us for the services that they need. So we're always trying to drive people back to our website. So we're able to really take our content, such as this video, and plug that into YouTube, and we'll actually embed it on our website directly. So it's a nice seamless experience for the person. So we'll link that story in a post and it'll go right to the page in the website. So they're able to both read or watch as well and listen along. So it's really the choice of however that person chooses to digest the content that they prefer.
Right. Meeting people at whatever platform that they
Right.
usually open up. Yeah. Yeah. Very good. You know, one of the questions I hear often around this topic is how do you approach people to be able to get them to tell their stories? Whether it's reluctance to be able to ask the question of someone, if it's someone that with lived experience, or possibly a service provider. What have you found that allows you to actually capture good stories or get past that barrier of I don't know who to talk to or where to get started?
Sure. I mean, that's a challenge all the time. I mean, we would love to have probably 10 times the amount of success stories that we have, but it is very intimidating for someone to step in front of a camera and share their entire life story. That's really asking a lot for people. I think that we are really fortunate where we are at Ohio Guidestone with what we do. And something that I do is constantly work with all of our regions and reach out to our providers and just constantly remind them of, hey, we're here, because they're with clients all day, right? That's not the first thing they're thinking about. The first thing they're thinking about is the success of that client and how to give them the best outcome possible. But they also see those things that our communications team doesn't often get to directly interact with, that the clinicians and staff and frontline workers do. So we're really driven to constantly stay in communication with them and remind them, hey, it doesn't have to be this huge life-changing thing. I think that that's the piece that people always think of. It has to be this earth-shattering piece of news that you have to share. And it's really in the simplest things for people. When people come in and they're making, small steps for lasting change. And so sharing those things and their path along the way is very, very helpful. So I think that just reminding people of that, and the people come along the way. It has to be presented to them. Some people will reach out and they say, I really want to share my story, or we'll just have an opportunity where we're able to interact with someone. And our staff is really wonderful at Ohio Guidestone too. They're super passionate about what they do and the services that they provide. And so they want to be able to share the success of their clients and the work that the client has done ultimately as well. So it's a lot of work to constantly push and remind,
Mm.
but that's ultimately how we're able to do those things, and just building a relationship with them too. So they're often, in this case, a client is passed to us or shared with us. That clinician or frontline staff worker make sure that it's okay that we reach out, or what's the best way. Do they need to give the introduction and connect the client with us? Is it okay if we just reach out to them? So there's many different ways, and oftentimes we're stretched across many different regions, so we can't be right there in front of them right away and have that conversation. So it's really just a lot of communication and warming them up to it, and making them comfortable. It's just you talking to somebody just like you have through this whole entire process. So it's often a wonderful result, and it is really empowering for that person too. They feel wonderful after they've been able to do that because they know it's going to help someone else too.
Yeah, yeah. Having the ability to say this is what not only you're going to get out of it, but think of the people that you're going to be impacting with it as well. That's going to carry a lot of weight. And
And that's
I
really
also,
their driver too. So
yeah, and I latched on to one of the things you said, and that is just to kind of keep it simple and not make it try to be like this massive undertaking where maybe it's just one step along the way. And it doesn't have to be the absolute success of that changes the world. Take it into little segments and break it into pieces, allow that story to be told. And that probably for you and your team and for the person telling the story allows it to be have this containment so that, okay, we don't have to get into all the details, or we don't need to tell the entire story. Let's just focus on maybe something that worked along the way. So I think that's a really great tip for people, those listening to this, to be able to say, how can I take that first step?
And the pieces that we can also tie in where if someone's uncomfortable talking about someone and we don't have to share those very specific details, we can have our team share that piece of the story and tie that all. So it's not always just necessarily the client sharing their story. We can wrap their whole team around it and really make it a group and collaborative effort, which is also very nice. And it makes them more comfortable too.
Yeah, that's a great thing to point out. Well, Jessica, so if outside of storytelling, have you seen any other tactics or approaches that have started to break down stigma?
Absolutely. I think then the second thing that we turn to is really sharing educational content.
Mm.
So we are very fortunate to be able to also have a diversity, equity, inclusion, and belonging division at Ohio Guidestone as well. So we will use often their resources and the things that they're focused on and working on as well. We also have an institute that does research. And so there are things that they are often doing with their studies that they're able to really help reach these other communities as well. So, for example, one of the things that I think is great is we talk about moms having depression after birth, but we don't often talk about dads. So, one of the really great efforts of our institute is talking about uh, dads and dealing with their, depression as well. And I think that that's also a very relevant area where a lot of men don't necessarily want to turn to mental health treatment, but finding groups and ways to support. And so reaching those people and sharing those statistics and the data behind it and what the results can be is really, really helpful. We also often do a lot of sharing national awareness days and getting involved with those types of things and sharing a lot of factual data. Something that we've also done this year is a monthly campaign. We call it See How We Shine. And so we're really able to talk about our very specific services because we do a lot and not everyone knows specifically what everything is. So we're able to help explain what that is in general terms and also provide some data points as well. What are the outcomes for people that are receiving this treatment? How has this helped? And then we're also able to share a viewpoint. So that may be a staff person, that may be a client, but they're sharing their impact and their experience of this specific program as well. And then we'll just share a lot of our outcome measurements, which are really, really helpful for people to see this has worked, this helps people. And also, May is Mental Health Month. We take that as an opportunity to really share a lot of data and help do a lot of advocacy and push for things at that time. But sharing, how many people struggle with mental health, that you aren't alone on this journey, and really making it relatable for people by sharing that educational content has also been really helpful as well.
Yeah, a lot of good information there that you just shared. Follow-up question: as we talk about stigma, it's oftentimes impacting the people that may not have a direct experience. As we think about education as a tool to use, how do you get that in front of the right people that may not feel like this has anything to do with them? How can that make an impact among those audiences?
Sure. And I think that's often who we're dealing with, right? Because a referral doesn't necessarily come from the person in need of services. It might come from a primary care provider. It could come from a probationary court. There's so many places that these types of things can come from. So helping educate and outreach to the community is very important as well, to really help understand what is mental health and how is that different from our Cuyahoga County team works with the police department to be able to help provide education and information and who can they call so that we can assist in a time of a mental health crisis, because sometimes those resources are not available for them to deal with directly. And I think being able to give them the correct outlet or resource to be able to receive help is just best for everybody. There's better outcomes for all that are involved. And ultimately, then we're improving our communities as we're, doing that work. So I think community outreach is huge. All of our areas do a great job at not only going out and talking to groups like this, but also just being at other community events, other fairs, going to the library, being able to reach people as well. And particularly as we were talking about before with substance use disorder, many times those things are not the person in need of the help isn't often the one that's reaching out for it. But we also are really big in creating access to care. And so we have walk-in services available for people so that if they're feeling like, okay, now is the moment, they can walk in and receive help. And so I think you're seeing trends like that across the industry. And I think just having more access points, more education, more storytelling, everything involved really has that overall impact to be able to help people understand how to receive help and where they could refer someone to have that help.
Mm-hmm. Yeah. I'm going to make a comparison here between branding and the elevator speeches that go with that, and how you may work with someone in the community. Let's say you're at a community event, a fair, and from a branding perspective, we talk often about what's your elevator speech? How can you get across a message from the very top in, maybe 10 to 15 seconds so that someone can understand what you're talking about? So I think we're in a similar situation where if you're talking to someone that says that substance use disorder does not impact them, for whatever reason, they've decided that's not part of their story. Do you have any advice, guidance, or how to get that initial, hey, substance use disorder is this? How deep do you go with it to be able to say this does actually have impact on your life so that you can capture someone that may not have realized that to begin with? Is that a fair question?
Oh, absolutely. I think this takes me to a conversation I was even in yesterday and talking about the housing displaced population, right? So it's really amazing that population of individuals take about 10 times to outreach to even hear the message that you're trying to tell them. So if you think about just how much effort that is, and I think the general population with trying to fight any kind of stigma deals with the same thing. We have to be really repetitive with our message, and we just have to keep saying the same things over and over again. And again, keeping it very simple. We do a lot of things at my agency, and there's so many services that we provide. And so introducing who we are and what we do have to keep it very simple because it can be really, really overwhelming for people.
Yeah.
But having it be relatable as to how it may touch their life, right? Maybe they don't have a loved one that has a behavioral health care issue, and so that's never touched their lives. However, we can always relate it to our communities and how we can improve our communities. So I think that that's really important. And especially for us, like talking about how we serve our communities, people don't necessarily have to come to a physical location. We go right to people where they are. And I think that that's really important for people to know and understand as well. So I think having those types of conversations, helping people understand, well, how does this work? It's not somebody in a white jacket, treating you. It's really somebody that maybe they meet you in the park, or maybe they meet you at the library, or we're working with students in the school. It's really casual. And so keeping the conversation casual around it as well will, one, also help fight the stigma, make it digestible for people, and then make it just really able for them to see, okay, yes, this does, have an impact on me. This is happening in the community I live in, using that educational content to give them those data points really can help. So it is always a little bit of everything.
Yeah, yeah. Always a challenge, and I'm sure that it does change a bit over time as just things within the news may impact people's perspectives. So keeping on your toes and making sure that you're aware of that as well.
Absolutely. Yeah.
Yeah. Well, Jessica, let's bring this around. Do you have a third tip, trend, thing that you've seen that has helped you battle stigma?
Sure. I think we just kind of touched on the last one, and that's really community partnerships, right? So building those partnerships with our communities and how we can help each other, how we can support each other, how we can educate one another and get involved. Like I said, I was able to go to a luncheon yesterday and really learn about another organization and all of the services that they provide. And it's really also just eye-opening to hear their viewpoints and what their experience is and what they're seeing as trends. And we're all really, we are trying to accomplish the same goal at the end of the day. So I think that having that extended hand and just always being aware and communicating, that's what we do. We're communicators. So excelling at that and being able to really outreach and not necessarily always be talking, but also be able to be listening as well as to what's going on in our communities. We have such a range of where we serve, from an urban community to a rural community. And so reaching people in those ways is so very different. And so we really need to understand how those communities work. It's really awesome that we're able to work with like our local Adams boards and have the support of them to be able to help reach clients in the ways that they need services. So I think having those community partners, community supports, and being able to support them as well is really just a well-rounded effort of being able to create awareness and help reduce stigma.
Mm-hmm. What kind of tools do you find the community partners are often asking for? What do they need to help support, to educate their audiences, so that others that are asking the same kind of question can know what to expect?
I think oftentimes it's really simple things like, can you get a social media graphic for us so that we can share this because this is really important? Or, hey, would you be willing to have like a 2-minute conversation and talk about what you're seeing going on right now and what the impact of these things are? Or if it's a new service that perhaps they've provided funding for that's created a whole nother outlet of services for people to be able to receive, how do we let the community know about that? They want those things to be successful. They've put their dollars behind it. So it's our job to be able to make them accessible for people. And they're obviously very willing to be able to create the resource to be able to talk about these things. So I think it's really simple, just in being able to do those things. When we introduce something new, sometimes we'll have an open house or we're providing a training. We have a wonderful therapist who talks about DBT. And, we do CEU trainings for providers to be able to hear more about those services. So we're really able to get involved from every avenue of our agency and reach people. And I think that that's a really great way to be able to educate, inform, and continue the efforts of what we're trying to do.
Yeah. And I imagine there's a lot of overlap that the listeners can take action on here. So once they get the storytelling part of their strategy implemented, and then they start build the education components, now you can take all of that and build that into some of your community partnerships. And really, if you want to drill down to certain audiences, I was just mentioning the differences between communication between urban and rural standpoints, that all can go into it to just make it more relatable to the end audience.
Absolutely. And understanding how people want to receive the message is really key as well. So I think, as you continue to get involved, you just naturally know who you're working with and who you're speaking to. And that's really, really helpful. So it's nurturing a relationship, it's fostering that, and it takes time. But ultimately, I think the results from that are much more fruitful in your efforts to be able to do that. And again, you can do things. So let's say it's something as simple as attending a table event in your community, being able to share those photos and say, hey, we were here, or hey, come see us. And using those things from a physical event to then a social event are also super helpful to be able to, again, expand your reach to do those things.
Yeah. Well, wonderful advice all around, and I appreciate this conversation. And I know we could go on lots of different other tangents and in areas and so on, because it really can expand in different direction. But why don't we, if you're up for it, you up for a few questions as it relates to your field?
Sure. Sure.
Okay. All right, great. So these are actually all from NAMI, so these are pretty well researched. A few of them go back a few years. I think there's 2021 was when they did some of these details, some of these questions. So they may have changed a little bit over the few years, but I think that they're really kind of interesting. I picked them out because I found them to be almost shocking, and so curious to see what your reactions to them. So question number one. What is the average delay between the onset of mental illness symptoms and treatment? Average delay. The three options that we've got here are A, 6 months, B, 2 years, or C, 11 years?
I hope I'm not going to embarrass myself, but I think it's C. I think it's C, 11 years.
Isn't that amazing? You're absolutely right. And it's 11 years between onset and treatment. I mean, that's certainly a statistic that speaks a lot about stigma and the non-willingness to find treatment when you need it.
Right. Absolutely.
Yeah. All right. Great start. Okay, next question here. So it's an economic question as it relates to certain elements of behavioral health. What is the annual worldwide cost to the global economy from lost production due to depression and anxiety disorders? So worldwide global economy cost from lost production. So the three options we've got here are 500 million, 1 billion, or 1 trillion. It's quite a range.
Right. I feel like it could be a trillion, but I'm going to go with a billion. I'm going to go with B, 1 billion.
So your gut was telling you 1 trillion, and that seems like a massive number. And that's actually what NAMI predicted
It
that.
is. Okay. Yeah,
Isn't that amazing?
it
$1
is.
trillion.
Right.
And I suppose if you're listening to this and you're someone that is may still have some hesitancies to saying that it has an impact on outside factors. I mean, there's an answer right there. You spend time as an employer or within your workforce to be able to be whether it's recovery safe or friendly, or just to be able to have support for mental health discussions with your employer or your boss. I mean, that's going to have an impact on your business and many others out there.
Absolutely. Definitely affects productivity for sure.
Yeah. Okay, last question here, and this is from 2021. What percentage of adults experienced mental illness? Was it A, 22%, B, 35%, or C, 57%?
I guess it depends how they define mental illness, but knowing NAMI, I think it'd be in the 50% range.
You know, and I think it depends on how you define it. In this study, their answer was actually 22%.
Okay.
Another question that I think just speaks to the impact of how people are actually maybe admitting to that it is mental illness, that there's something that there's a factor there. Then I would have thought, I would have guessed it would have been a higher number as well.
Sure. And I think also talking about that time, right, 2021,
Yeah.
I think the numbers definitely have increased since then. But again, it's got to be someone that has had a diagnosis likely. So, and we're talking here about stigma and those that have untreated mental health as well. So,
Mhm.
I always want to think that we can be able to create all the access in the world for people and help with what they need. But that's why this is so important to talk about as well and be able to help knock down all of those barriers so more people can receive treatment and the help they need. Absolutely.
Absolutely. Yeah. Well, if there's anything that may have come that was good that came out of the COVID era, I do think there's been a lot more awareness that has come since that point, and hopefully we can continue that trend, and hopefully with the help from your organization, continue building upon that. So thank you again.
Thank you so much.
Jessica, for our listeners, anyone that wants to get in touch with you or want to learn more about Ohio Guidestone, how can they do that?
Sure. You can visit us online at ohioguidestone.org, or our phone number is 866-4-CALL-OG. So it's the number 4-CALLOG, Ohio Guidestone.
Wonderful. Again, thank you for being on the show, and thank you, listeners, for tuning in to another episode of 3 for 3. I hope you got a lot of good stuff out of this, and take this, make a difference, make that list of notes, and figure out what you can do. Whether this is something that's impacting you directly, or you're learning for the first time about topics that you didn't know about, make those notes, get on it, and change things around you. Until next time, signing off.